A global and very important topic. The topic of high blood pressure. When do we detect it and what causes it? What needs to be done to lower blood pressure and keep it normal? What can be done to prevent it from rising at all, to cure hypertension? I really liked it when this topic became relevant for you, my viewers, and a huge number of people started watching my videos, leaving comments, and actually getting responses from me. I liked that this topic was so relevant that I think it's worth taking another, more detailed look at the issue of hypertension. A few points. Point 1. What blood pressure is considered normal? There are two types of blood pressure. The upper pressure and the lower pressure, or maximum and minimum, systolic and diastolic. Normal systolic pressure is from 100 to 140, and diastolic is from 60 to 90. So, normal isn't just 120 over 80, but also 100 over 60 and 140 over 90. I want you to remember this number. 140 is normal and 90 is normal. It's the kidneys that create blood pressure for a person when they can't cleanse the body with the amount of water the person drinks. The kidneys need a dose of water I drink, 30 milliliters per kilogram of body weight. But this number, which is recorded by the World Health Organization, I actually flip it around with the 3. For the kidneys to be able to cleanse 30 kilograms of my weight, they need a liter per day, water in the amount of 1 liter per day. If it's 60 kilograms, that's 2 liters, 90 kilograms, 3 liters. And so on, just keep counting. And don't be upset if your dose comes out to 5 liters. That's just because your weight is that high. But you can't reduce this dose because the kidneys have to flush your whole body. Next. When the kidney can't flush your body, either because there's not enough water or because the kidney is sick from cold feet, which also happens, then, to clean you better, the kidney releases a series of hormones, renin, angiotensin I, angiotensin II, and angiotensin. Angio means vessels, tensor means constrictor. Angiotensin II constricts the blood vessels and raises blood pressure. In other words, the kidney always raises blood pressure when it can't clean you with the amount of water you drink. Hypertension is a disease of people who don't drink enough water. That's a fact we also need to acknowledge now. Next, how do we treat hypertension? It's madness. In medicine, I call it madness when we simply lower high blood pressure, just bringing it down, without addressing the root cause of the disease. Let me repeat, the reason is that you don't drink enough water. And if your blood pressure is just being lowered with medication, that's a road to nowhere. The pressure will rise again, and then rise again, as soon as the effect of the pill wears off. What pills do we use to lower blood pressure? Well, there can be different kinds of pills. There are pills that affect the kidneys. Those are the same ACE inhibitors. That's the same enalapril and other pills. There are sartans, angiotensin receptor antagonists, sartan drugs. The same valsartan, telmisartan, azilsartan, edarbi, and others. They harm the kidneys. And diuretic drugs. The same furosemide, the same hydrochlorothiazide, and even indapamide, which I praised in the previous video as not so toxic, but they all affect the kidneys. They shut down the kidney mechanism for regulating blood pressure, and that's a dead end. Because the kidneys will be damaged by this, and then they'll raise the blood pressure again. That won't help them at all, just lowering the blood pressure. Sometimes doctors take a different approach. Sometimes doctors try to affect blood pressure through the heart with pills, either stopping the heart or poisoning it. Stopping the heart, that's a joke. Metoprolol, atenolol, bisoprolol, all the lols. All these lols are beta blockers. They block adrenaline from reaching the heart. The heart slows down, and if the heart slows down and works less, the blood pressure will be lower. Makes sense. But the heart slowing down is bad for it, or there are drugs that poison the heart. And by poison, I mean calcium channel blockers. That's amlodipine, nifedipine, and also lurkinidipine. You hear that, right? The analogy is in the ending dipine. These dipiness poison the heart. They prevent calcium from getting in. Calcium channel blockers stop calcium from reaching the muscle fibers, and they poison the heart, preventing it from working strongly and efficiently. They slow down the heart, poison the heart. As a result, they can be used for certain tachycardic forms, tachysystolic types of arrhythmias. But if you use them, be prepared that the heart will weaken and you may trigger the development of heart failure. Keep that in mind as well. There are safer vasodilator medications. Vasodilator drugs like papaverine, drotaverine, the same no-spa, platifillin, eufillin, clonidine. These fillins, right? Vasodilator medications. The best drug is less toxic to you, but its effect is also a bit blunt. So, for example, the kidney constricted the vessels, and this drug dilates them, like dibazole. And then what? Inject magnesium sulfate. This will dilate the vessels and lower blood pressure, but only for a short time. So, as emergency aid it helps, but for regular use, it's madness. Yes, there is one good medication. People ask me, "Doctor, can you name at least something good?" A good medication is moxonidine. And why is it a good medication? It doesn't affect the kidneys. Moxonidine doesn't affect the heart. Moxonidine doesn't affect anything dangerous. It acts on the autonomic part of the central nervous system, works on the brain, and lowers blood pressure by reflexively dilating the vessels through its effect on the autonomic system. But again, moxonidine can be used. It's less toxic, but not on a regular basis. You can use it when you need to quickly bring something down. It's what's called an emergency medication. But if you use it constantly, you develop a tolerance, it stops working, and you end up back in the same cycle. And most importantly, the bad thing about moxonidine is that it doesn't address the root cause of the problem. The root cause is that your kidneys aren't working properly because you don't drink enough water. And there's one more group of medications. These are the combination drugs. That's when you have a calcium channel blocker together with, for example, sartans. The same goes for, there's a huge number of combination drugs, like those starting with captopril, captopril, and hydrochlorothiazide, INAP, and other medications that simply contain several, sometimes even 3, components. But they're harmful. They damage both the kidneys and the heart, and the body just can't handle taking such a large amount of poison for long. But that's not what you should be doing. Maybe in the last video, I didn't pay enough attention to this. Now I'm drawing your attention to it. You need to solve the problem radically and cure hypertension. You need to cure it. Cure it so that your blood pressure doesn't go up at all. Cure it. To do that, you need to give your kidneys what they need. The kidneys need water. You need to drink enough water so that your kidneys have the resources to cleanse you. To your health. So, first, calculate how much water you need to drink based on your weight. For example, your weight is 105 kilograms. You need to drink 3.5 liters of water per day. That's it, period. No less than that. That's the biologically acceptable minimum. If you drink this amount of water, then you can move on to other things. If you don't drink this water, then you can't do anything else. You won't help yourself at all. Just keep taking pills and go on dying. Remember, water by itself doesn't cure anyone of anything. But no other treatment works without water. That's the point. So, the simplest thing, what thousands and thousands have asked me in the comments, what should you drink? You need to drink water. That's exactly what you don't want to do, but you need to drink water. That's number one, first. Second, as soon as people start drinking enough water, their kidneys start working well and their blood pressure stops going up. And it works. It works. It gets results. Just drink as much water as you need. And your blood pressure wouldn't go up if it weren't for one, but by this point, many people already have serious damage to their bodies, the heart, the kidneys, the blood vessels, everything. Severely damaged. And that's why, in most cases, just drinking water won't be enough. You also need to get your kidneys working. And that means 2 procedures. The first is infrared heat, tourmaline products, tourmaline ceramics. For example, I show this, a tourmaline belt. You wrap it around your body, and after you've wrapped it, you need to warm up your kidneys. Set the temperature on the remote to 55 degrees. Warming up the kidneys is extremely difficult. They are located deep inside. That's why you need to warm your kidneys for about an hour, usually in the evening. And warming the kidneys means that more blood will flow to them. They'll start working better, cleaning you out more effectively, and there will be fewer factors that raise your blood pressure. You need to warm your kidneys for an hour a day. Well, you can do it several times. You can do it twice a day. And most importantly, after warming the kidneys, you need to place the same belt, the same mat, down by your legs. Legs mean your shins and thighs. And additionally, you should warm your legs, shins, and thighs under a blanket with a ceramic mat under the blanket until your legs start to sweat. You need your legs to sweat from the warming. And not your whole body, but specifically your legs. And warming your legs until they sweat gets your kidneys working. And then your kidneys start to cleanse your body well. This is a factor that helps prevent your blood pressure from rising in the future. So, warming your kidneys, warming your legs, drinking water, warming your kidneys, warming your legs, these are the things that will cure hypertension. But what about pills? When should you stop taking pills? It's madness for people who, after watching my video, stop taking their pills. Madness. Why would you stop taking pills you're dependent on, like an addict? You absolutely must not stop taking them. You're already dependent on them. If you quit your pills, you'll end up with a hypertensive crisis. You must not do this. You shouldn't just quit the pills, you need to replace them. Oh, so what should you replace them with? And now, guys, here's the 4th component of the recipe. So, we drink water, warm up our kidneys, warm up our feet before bed, and measure our blood pressure 3 times a day. We measure our blood pressure, and remember the number we started with, 140/90. And as long as your blood pressure is still high, above 140, above 90, you keep taking your pills. But thanks to drinking water and warming up your kidneys and feet, very soon there will come a moment when your blood pressure stops going above that normal number. And only then, when your blood pressure becomes normal from the warming, do you skip your next dose of the pill. You don't quit, you just skip the next dose. So, in the morning you measure high blood pressure, you take a pill. At lunch, still high, you take a pill. In the evening, it's normal. And you skip that pill. The biggest lie doctors tell is that you need to take pills even if your blood pressure is normal, not to take any breaks. That's a complete lie. You shouldn't take pills when your blood pressure is already normal. That's why, first, by using water and ceramics, you cure hypertension. And when your blood pressure stops rising above normal, that's when you skip the next pill. Yes, the next morning your blood pressure might be high again. You take what you were taking before, at lunch, in the evening. But when it's no longer above normal, you start skipping. And by skipping your medication more and more, over time you move away from these pills as you no longer need them. Your kidneys have already started working, and you no longer have hypertension. Hypertension is a condition where you don't need to take pills all the time. With hypertension, you need to cure the hypertension itself. Cure it so you don't have to take pills constantly. Here is some information from Dr. Golad, how to get off blood pressure pills. First, we treat the hypertension, and only then do we stop taking the pills. That's the information I have for you today.